welcome to icareforbillion. Gesundheit ist klug, a famous saying in German which means health is happiness. That's right, today we're talking about Germany, which is officially known as the Federal Republic of Germany. It is a sovereign state in the Central Western Europe. It includes 16 constituent states, covers an area of 385,386 square kilometers. Moderately, it is temperate seasonal climate. Germany is one of the most populous member states of European Union. Germany specializes in a lot of sectors other than healthcare. It is known for its excellent quality and innovative techniques. It is also known worldwide for having great beer. It is the biggest car producer in the world, which stands third after Japan and United States. It has 300 different varieties of bread. For inhabitants, bread is more than just a food, it's culture. Today we'll be speaking about German healthcare system. Germany has world's oldest national social health insurance system, origins dating back to Otto Bismarck social legislation, which include Health Insurance Bill in 1883, Accident Insurance Bill in 1884, Old Age and Disability Insurance Bill in 1889. Bismarck stressed on key principles: solidarity, young for old, rich for poor, health for sick, singles for family. Germany has universal multipayer healthcare system. It has the combination of social health insurance and private insurance. According to World Health Organization, about 77% is government funded, the remaining 23% is privately insured. That means the social health insurance covered about 90% of German population, whereas the remaining 10% is only privately insured. In Germany, there are 82.2 million inhabitants. 90% covered by social health insurance, 10% are privately insured. Social health insurance membership is mandatory for employees whose gross income does not exceed 56.250 euros per year. Service in kind system with moderate co-payment, free choice of sickness funds and providers, that is GP and specialist. There is uniform contribution rate, that is 14.6% of chargeable salary, shared between the employee and the employer, 7.3% each, plus insurance-based additional contribution rate, which is average about 1.1%. Moving on to the next segment, the important key features in healthcare system between the patients, the providers and payers. Patient get free choice and access, choose the provider from public, private, non-for-profit, GP specialist, hospitals and rehabilitation. And then provider provides its own benefits to the patient. Then the patient, mandatory insurance, wage related, pays contribution, choosing from sickness funds or private health insurance to the payer. Payer in turn provides risk sharing to the patient. Then the provider bills for service to the payer and the pays reimbursement to the provider by DRG or FFS. The overall goals of German healthcare system is equity, solidarity, security. Equity. Everybody gets all necessary medical services. Solidarity. Everybody pays according to his financial abilities. And security. Government takes on the responsibility to shape, provide and control the services. In this figure, it clearly seen that a healthcare expenditure is increasing in Germany. From 1995 to 2016, that is 189.951 million euros to 359.1 million euros. Worldwide healthcare expenditure, which is about total $6.5 trillion, Germany alone contributes to 6.3% compared to 93.7% rest of the world. The key figures: general statistics of Germany, inhabitants 82.2 million, male is 40.5 million and female is 41.7 million. The number of employed is 43.4 million. Age more than 65 years is 17.3 million, that is 21.1% of total population of Germany, which is quite high. Healthcare expenditure 344.2 billion euros. Healthcare expenditure per GDP is 11.3% and healthcare expenditure per capita is 4213 euros. Coming on to the payers in Germany, the two main sectors: social health insurance, private health insurance. Social health insurance, there are 69.9 million insured person, whereas in private it's 8.9 million. In social, there's 124 sickness funds, private there's 43 companies. In social health insurance, the contribution depending on the income, which is 15.7%, whereas in private, tariff depends on individual sickness risk. Compulsory until the income ceiling of 56.250 euro per annum in social health insurance, whereas voluntary in private health insurance. In social health, dependents are insured without remuneration, whereas in private, dependents need own contract. In this figure, you see the healthcare expenditure from social health insurance, that is divided in hospitals, pharmaceutical equipment, physicians, dentists, remedy and therapeutic appliances and other services. This total about 193.63 billion euros, in which 67.86 billion alone contributes from the hospital treatment, that is the largest amount spent in compared to other sectors. Then few key figures in healthcare providers: in office-based physicians, acute hospitals, post-acute and rehabilitation hospitals, nursing homes and pharmacies. The number of employees in different industries in Germany, clearly you can see that healthcare has the highest, which is about 5.2 million, followed by retail 3.03, steel, machine building and automobile industry, electronic industry and construction industries follows, which is about least 2.51 in electronic and 0.75 in construction industry. And in patients, the cases: reimbursement, ambulatory cases, acute hospital cases, length of stay, which is average about 7.3 days, rehabilitation hospital cases, and patients in nursing home. The next is Euro Health Consumer Index in 2014, and Germany ranked 9, whereas the first is Netherlands, followed by Switzerland, second and third is Norway. In this, Germany scores about 812, that is patient rights and information is 121, comparatively good, accessibility is 188, which is the highest is 225, which is in Belgium and Switzerland. The outcomes is 229, range and reach of services 94, prevention is 95, which is quite good, which is the highest here is 107, which is in Iceland, Norway and Spain. Pharmaceuticals is 86, which is the highest, which is in Germany as well. So this contributes to a total score of 812, which ranked 9th, stronger on the quantity than on the quality. German healthcare system, there are more than 100 important federal legal codes. There are 42 laws, 15 regulations, 13 directives and recommendations, and more than 30 contracts. Coming on to the self-administration, government, Federal Joint Committee, 13 members with voting rights, impartial chairman, 2 impartial members, 5 representative Association of Social Health Insurance, maximum 5 patient representatives, no voting rights, 5 representative healthcare providers, that is 2 in German Hospital Federation, 2 in National Association of Social Health Insurance Physicians, and 1 in German Federal Association of Sickness Fund Dentists. In this, it clearly shows the high pressure for changes, divergence between the growth of health expenditure and growth of GDP, which was quite high in 2005, as compared to 2012, there's high healthcare expenditure with low GDP. Now let's move on to our interview session. It is very imperative to get an insight about German healthcare by the citizen of Germany itself. It was an honor for me to interview Professor Dr. Rainer Sibyl, who is the Professor of International Studies. He will be giving us an overview about German healthcare system, the co-payments, and of course the DRG system. And he will also be touching down about aging population, how technology can drive cost, and of course management of financial sustainability of healthcare system. So let's hear it from him. Hello Professor, welcome.
Welcome Ali, welcome you all around.
All right, Professor, moving on to our first question, can you just give a brief overview about the German healthcare system?
Yeah, so the German healthcare system is one of the basic 3 models of healthcare system we can find on the globe. It's traditionally, since more than 100 years, based on so-called social health insurance. So that is a mandatory health insurance system. Every inhabitant in Germany is forced to have health insurance. You can choose between different health insurances, but that covers all inhabitants in Germany. So everybody has health insurance, and this health insurance is covering everything you need around healthcare. So it offers universal health coverage for everybody, and it is free at point of delivery. So you simply show your health insurance card, and then you get any kind of healthcare you are in need of.
Professor, can you just explain to us about what are the percentage of cut that goes from the salary to the tax, followed by healthcare budget, and go on?
So at the moment, this healthcare the contribution to health insurance are based on wages. Everybody who is employed and has a contract has to pay to the social health insurance companies, and at the moment the percentage is 15.5%, which is split between the employee and the employer, roughly half-half, and that is how it is financed.
And what about the people who cannot afford or who are not working, who are jobless? And what about that? How is for them it's covered?
Yeah. On the one hand, if, for example, in a family, if one member of the family is working, the whole family is covered based on that one participant who is contributing to health insurance. The whole family is covered. For people who can't afford that, we have an extended social welfare system, and then the state or the government will pay for these people the health insurance.
Okay, so then moving on to our next question, Professor. So what are the major problems right now the German healthcare system is facing?
Well, the one thing which is not unique, but we are tremendously challenged by is the aging population and the consequences, the impact of that on the question of need for healthcare in the population. Another driver in our system is medical progress, technology progress, which drives a lot of the costs. We want to get the highest quality of care and give it to everybody, and that of course is a very costly way to serve the population. Another point is that we are challenged by sustainability of our financing system. More and more people are retired, more and more people are not working. That means the number of people who are contributing to the health insurance based on their wages is decreasing, and at the same time the beneficiaries of the health insurances are increasing, staying longer, living longer, and that means the sustainability of our financing system is in question. And the third big issue we have is on the provision of care, because we still have a highly fragmented healthcare provision system. We have hospitals, we have rehab centers, we have nursing care, we have elderly care, and we have, and that is unique in Germany, we have more or less all medical specialties also in ambulatory care, so as office-based physicians, office-based specialists, and that creates a lot of inefficiencies on the one hand, oversupply, we call it as economists, and it is fragmented. That means there is a lack of coordination between the different providers of care.
Okay, so I had a chance to speak to some of the healthcare professionals from Germany who are working. They do mention about one thing, that there's a lot of overuse of the system. For example, like one patient who has a card, health insurance, so he goes in the same problem, he goes for the 10 doctors.
Yes.
So how do you try to come up with a solution to that particular problem?
Well,
is there really that problem?
That is part of the problem, that as I said, oversupply, that we sometimes deliver much more care than it would be needed, requested by the patients. And one of the crucial things behind that is lack of coordination, and coordination means simply that there is not enough information flow. We don't have so far something like a national electronic health record for everybody or stuff like that, which would help tremendously to follow up what kind of treatments, what kind of medications, for example, a certain patient already got. And that lack of information flow creates inefficiency on the one hand, it creates quality problems on the other hand, because simply the different physicians do not have a clear picture on what the patient already gets, or what kind of medications, for example, are there, or even some basic stuff like allergies, sometimes not known. And that creates quality issues, that creates cost issues, and that is a big part of our problems. Yeah.
Okay. Can you just also give us a brief about the DRG system which you have?
Well, due to that increasing costs, more or less 15 years ago, the government introduced the DRG system as the reimbursement system for our hospitals. That means that they now get paid per case depending on the diagnosis, the case is defined, and defined based on that definition of diagnosis, the hospital gets a lump sum for treating that patient, independent of how much cost the hospital really invest or spend in that case. These DRGs are calculated on an average cost level, so it is reflecting the costs of the hospitals, but only on an average level, and that means all the hospitals who treat a patient, a certain case above the average in sense of cost, are more or less going to struggle with on the economic side.
Okay.
So it's a typical and more or less nowadays global instrument to put cost pressure on the hospitals.
Okay. Do you have any out-of-pocket payment in Germany?
We have out-of-pocket payment in sense of co-payment, for example, for medications. For some of the medications, a basic level of €5 per package, for example, but with clear caps. We have some co-payment on the hospital side. It's €10 per day for the first 10 days. So that means, yes, we have small pieces of co-payment, but not in a sense that it is really limiting access to care, and not in the sense that it also, and that is for the economists, the bad side, these co-payments are not changing attitude and behavior so far.
All right, then moving on to a final segment, that is a take-home message we'd like to give to all the viewers across the globe.
Well, I think Germany is a very good example of universal healthcare coverage. We have a lot of advantages based on our health insurance system, but we are also struggling like a lot of other countries. We are delivering high quality of care, but on a high cost level. And the challenge for the future will be to create a higher ratio between the value we create on the one hand and the cost we spend there on the other hand. And that is one of our big challenges, how to solve that in future to get more out of the money we are spending there.
All right, then. Thank you so much. So thank you for joining us. It was a pleasure having you and knowing about the German healthcare system. Thank you, Professor.
Thank you, Ali, for that interview. It was a pleasure.
Thank you. Now I'll be speaking with Professor Dr. Shlush, who is the Chair of Operation Management from University of Beirut, Germany. He will be speaking about the main challenges in German healthcare system in managing financial resources and also the strengths in a system in the long run. So let's hear it from the professor. Hello, Professor. Thank you for joining us.
Hello.
Professor, let's move on to our first questions. What are the main challenges faced in controlling management now in German healthcare system?
Well, the main challenge is that in managing financial resources for a hospital, we have to be, on the one side, to be operationally excellent, and we have to develop strategic competence at the same side. So we need to calculate cost per patient, and we need to find ways to save costs, but on the other hand, it is about quality, it is about outcome, and even financial experts and medical knowledge both together should show hospitals the right direction into appropriate strategic decisions.
So what are the strengths in the system on a long run?
Well, the German healthcare system, of course, has one first strength, and that is access. We have a compulsory insurance system which allows us to provide high quality care to almost everybody. Well, the cost level is not too high, but we always have to balance cost and quality at the same time.
What might be applicable to the developing countries?
Well, in developing countries, of course, it's a matter of the insurance system. So get more people under insurance coverage. This, especially for countries like India, is a very first step. And then, on second, it is necessary to develop integrated systems for the high quality need and for primary care as well. So integration is the very interesting term here.
Okay, then moving on to a final segment for your last take-home message. What is your key advice to the high-achieving youngsters that want to make a difference in healthcare system?
Yeah, first of all, it is about goal setting. Think about the values you want to achieve, you want to accomplish with your activities, with your career steps, and then once you have found the correct values, then think about the appropriate alternatives, and that's perhaps the most general thing in life.
All right, fantastic, Professor. Thank you. It was a really pleasure having you here. Thank you for joining us. Thank you.
Thank you for this interview.
Next up is a dear friend of mine, Arcos. Arcos is a practitioner who will be speaking about the German healthcare system, the main challenges faced by him. Let's hear it from him. Arcos, can you just help us know about the German healthcare system? Because I've been speaking to quite a lot of people here. So can you just give us an idea, an overview about what this German healthcare system is facing right now, the problems, and what you think from your perspective as a healthcare professional that you think that this could be the solution for this kind of particular problem?
While the German system works pretty well, we obviously have a lot of problems, and I'm not going to be able to talk to you about all of them, but I'm going to tell you, I think, about 3 problems that I can think of that we face in a hospital. And I think the first of them, and the most important one, is the problem that there is a gap between the inpatient and outpatient services. So these 2 services are not working together. They're 2 separate services, and patients are treated in the 2 departments differently. So what we need to do, we would need to find an overlap for these services. This concerns the financial point of view and also the medical point of view. So we can basically come to a point where we utilize our services efficiently. That would mean that we would reduce the inpatient services and extend outpatient services, and also this could save a lot of costs to the hospital. And right now the problem is that these 2 services are independent, so patients are kept too long in inpatient services and they're not seen that much in outpatient service.
You did mention about the inpatient service, you want to reduce it. So what I believe, the inpatient service is the one which actually gets money to the hospital.
Of course, but it's like if you keep a patient too long in a hospital, you're actually using up a bed that you could use for another patient. So what you could do is just keep your inpatient time to as short as possible, and then see those patients in the outpatient service till the end of the treatment. And in the same time, you're able to admit another patient for inpatient services, and just go on and on and on. So basically combine the 2 instead of keeping one patient in inpatient service for the whole period of time.
Okay, fantastic. So moving on to the next problem.
So I think the next problem would be a healthcare that should be driven by the market. So what we have right now in Germany, it's a healthcare that has systems which keep primary care physicians and all sorts of physicians in place, and it's not a market-driven healthcare. So what we would need a free healthcare or a free market where every physician should fight for their patients, and this would drive quality, because every physician would need to get new courses, to get new trainings in order to keep their standards. And that would mean that if you're a good physician, then you're going to have patients, and if you're not, then you're going to lose your patients. And this is not the case right now, since we have a lot of physicians who basically they haven't been to a training for the past 10 years, and they still keep seeing patients because they have a pool that is their pool of patients. So I think going to a market-driven healthcare, especially for a primary or the private practices, it would be a lot better. So the third issue that I see is that we should focus a little bit more on prevention, which we do, but we don't do enough. So we should focus more on vaccinations, and we should also focus more on primary checkups, so healthy checkups. So people would go like 1, 2, 3 times a day. 3 times a year to checkups. So we would have a better prevention system, which we still don't have.
From my understanding and knowledge, what I feel personally is, in German, especially in healthcare system, we do have, the patient pays taxes, and through taxes goes to the healthcare budget, and that goes back to you. So basically the patient gets in and gets out without any payment. It's everything through the card. So obviously there is definitely, when that happens, and there's a free healthcare system, so early detection is definitely possible. How are you, in what perspective you're saying that it should get better? I believe it's already good.
Well, I think this has also a little bit to do with the German mentality, because Germans are not the typical spenders. So Germans like to keep it low key and save as much as they can. So although we do see people who overuse the system, this is not a standard in Germany. So most people, they're going to go see a doctor, and if it's necessary, they're going to see another one. Obviously, you're going to have also people who are going to overuse the system, but this is not the rule.
Correct. Fantastic, ACOs. That brings to an end of the topic, the final one, that you would you want to give a message to the people across the globe regarding what your perspective towards healthcare system and how we can better the healthcare system, or any take-home message to the viewers across the globe?
Yeah, so I just read a book not long ago, and Regina Herzlinger of Harvard, she put it in a very, very interesting way. She said that all you need is a generation of empowered, pragmatic, narcissistic, and manipulative young physicians who have a focused attitude, because focus leads to excellence, excellence leads to lower costs, and I really hope that we are the generation.
Wow, that was very well said, ACOs. Very well said. All right, ACOs, thank you for joining us. It was a pleasure having you.
Thank you for having me.
We have reached to our final segment of the video now. All points considered, to sum up the analysis and interviews, we can say the German healthcare system caters to one of the best healthcare systems in the world. Like any other system, it has its own drawbacks. Now we'll be discussing about the 5 essential criteria in healthcare system and rating it on a score of 1 to 5, 1 being the least and 5 being the highest. And also we've chosen some important health indicators which helps us to assess the healthcare system. To start with, availability of healthcare. The number of physicians per 1,000 is 4.2 and hospital beds per 1,000 is 8.2. Speaking to the German citizen and healthcare professionals in Germany, in contrast to the population, which is 82.2 million, with the availability of healthcare is far superior, for which we rate 5. But of course it has own drawbacks. We clearly see from 1960 to 2018 there's a drop of hospital beds from 10.2 to 8.2. But of course there is extended sectors of ambulatory and hospital care. Accessibility to healthcare. As you've seen in Germany, the universal healthcare insurance coverage, about 100% of populations are covered with health insurance, which clearly suggests that there's very good access to healthcare. Of course, on a larger scale, private insurance get more access in compared to the social health insurance, but it's more or less the same. For this, we would rate Germany in accessibility 5. But coming back to the drawback, we do clearly see that due to good access, the patients do take second or even third opinion, for which Germany system itself doesn't have a tracking system like a universal EMR to track and fill up these gaps. Acceptable healthcare. Due to high literacy rate, which is 99% of population in Germany, people accepting the treatment is high. There's also presence of alternate and complementary medicine, which people believe in, and use of it, like homeopathy, is widespread in Germany as well as in Western world, for which we would rate as 5. Affordable healthcare. Universal coverage, generous benefit package, very low co-payment, equal distribution from the salary to the health insurance. It's clearly based on solidarity. Health for sick, for which we would rate as 4. Let's take a hypothetical situation. Person A, who eats healthy, no substance abuse, takes care of himself, stays healthy. Person B, who has a very bad diet, who has a substance abuse, who falls sick quite often. So health pays for sick. It's purely based on solidarity and risk pooling. On a long run, it's a question unsolved. Sustainable healthcare. The main goals of healthcare system are to improve the health of the population they serve, respond to people's legitimate expectations, and offer fair financing. As a result, the health system in Germany is subject to continuous adaptation as well as public and political discussion about its design. We would rate it at 4. Quality healthcare. Germans have excellent quality. Due to increase in technology, on the other hand, there's increase in cost. On a long run, on any healthcare system that matter, it's a huge question again by itself, which is unsolved, for which we would rate the system as 4. Technology drives cost, which clearly takes us to our next video about American healthcare system. We're visiting United States to give an overview about the healthcare system and the challenges and problems faced in American healthcare system. We're also talking about the transition of Obamacare to Trumpcare, the gun violence in America. Stay tuned for our next video. Thank you for watching us. Like, share, and subscribe to our video. What we believe in iCare4Billion is knowledge has to be shared and passed on. Thank you and stay healthy.